Over the past few years, you've heard from the students how the Access to Care Fund has helped them with their patient care. This year, we want you to hear directly from the patient's perspective. Perhaps too often we get judged by our parents, and if I'm missing my front teeth, your opinion of me will be different than if I have a full set of teeth. And so this is a chance to make things better for them.
When I was a kid and my teeth were starting to deteriorate, they were starting to yellow out really dramatically, and the cavities were already noticeable. In school I got bullied a lot because of it, and they didn't really see that it needed help. They said, "You're a disgusting pig, you're not really brushing your teeth." And I try to brush every night, but it doesn't work, it's not working out, I don't know what's happening. I'm trying to go to the dentist, but they also say it's not working out because I don't brush, but I do brush.
It was tragic to see, because other people would think that either he was, when he was an older teenager, he was a drug addict, or that he drank alcohol, or that basically he just didn't have any hygiene.
When he was referred to our clinic, he was not in a very good health condition. He had lost a lot of his teeth. The remaining teeth and also the gums were all infected, painful, and he was suffering. Because of malnutrition that was caused by loss of teeth and non-functional remaining teeth, he had lost a lot of weight. And when I saw him, he was slim and frail, to be honest with you, at the age of 22.
I thought my case was impossible at one time, and that I would have to have no teeth for the rest of my life. Thinking that when you're 14, 13 is dreadful.
When I presented the treatment plan to him and to his family, they were all very happy that there is a solution for this big problem. But then they were very disappointed and sad that they cannot afford it, because it was a relatively expensive treatment in our department. That's why at that stage, I decided to apply for the Access to Care Fund. Maybe the only other option for this patient was no treatment and suffering from all this pain and chronic infection in his mouth, or maybe just taking all the infected teeth out and carrying on with no teeth in his mouth at the age of 22. So I think in his case, the Access to Care Fund made a very big difference in his life.
When I came to receive my dentures, I was actually with one of my friends, and I was really excited about it. Having a smile again, being able to eat is a big thing. Things like eating simple potatoes is amazing already.
We went home, and he stopped to go pick up his sister at school to surprise her.
Yeah.
I mean, that was probably...
I smiled at her, and she was like, "Oh my God, Scott, your teeth are amazing."
So I look around now, and when he's smiling, or even if he's not smiling, people are not looking at him going, strangely looking at him. Now, even some girls have been starting to look your way.
I would like to sincerely thank all those who have donated to the Access to Care Fund. You might not be well aware of the influence of your donation on a patient's life.
Thank you very much.
That's one sentence. Oh, merci beaucoup.
Oh, you gave the second sentence in French then.
Thank you very much for helping me, for helping Scott start to begin his life. It seems like he's been reborn. He is a totally new child now. We have...
Child, I'm
Oh, I'm
22.
I'm sorry. He's a totally new, happy kid, a big kid. Thank you so much for your help. Thank you for helping us smile again.
I'm still getting used to smiling. It's hard. I always smiled with my mouth closed, so this is the best I can do.
That's good. Excellent. Very good.
What a change, eh?